The paper delves into the role of virtual reality, VR, in mitigating mental health diseases, specifically stress, anxiety, and depression. It is evident that mental health disorders are a global burden, with approximately 1 in 8 people worldwide living with a mental disorder. A literature review aimed to ascertain the effects of VR therapy on stress, anxiety, and depression, revealing 9 studies that met the search criteria. 5 of these studies focused on mental stress and showed effective results in reducing it through VR therapy, while the other 4 targeted mood disorders, social anxiety disorders, depression, loss of happiness, and sleep deprivation, also demonstrating immense potential in reducing mental illness via VR. The findings are in favor of the effectiveness of VR in reducing stress, anxiety, and depression, although there is insufficient evidence to consider VR as solely independent treatment over traditional medication. In the future, the limitations can be overcome to rely on VR and use it in hospitals as a reliable source of cure for mental illness. Furthermore, the paper discusses the prevalence and impact of stress, anxiety, and depression in society, with a focus on the United States. It highlights that these disorders are classified into different categories such as simple phobia, social phobia, generalized anxiety disorder, post-traumatic disorder, panic disorder, and obsessive-compulsive disorder. The Global Burden of Disease study predicts that major depressive disorder will become the second leading cause of disability by 2020. The paper also reviews various treatments for stress, anxiety, and depression, including physical activity, nutrition, vitamin D, music therapy, electrical stimulation, and virtual reality. These treatments have been shown to enhance symptom control, uplift mood, alleviate anxiety, and improve overall quality of life. The paper emphasizes the importance of these treatments, particularly highlighting the role of non-pharmacological interventions in managing stress, anxiety, and depression. It underscores the need for further research to understand the efficacy and potential of these treatments, as well as their integration into mainstream healthcare practices. Research in virtual reality, VR, and mental health has demonstrated the therapeutic potential of VR in alleviating mental stress, social anxiety disorders, mood disorders, and sleep deprivation disorders. Studies have shown the effectiveness of VR in reducing fear of heights and symptoms of post-traumatic stress disorder, PTSD. A systematic review of 9 studies, published between 2014 and 2024, examined the impact of VR therapy on stress reduction in diverse populations. The studies employed various VR scenarios, including 2D and 3D environments, immersive VR exergames, and aromatherapy, with durations ranging from 63 seconds to 2 hours and frequencies from once to thrice a week. The results revealed significant reductions in stress levels, improved mood, and enhanced sleep quality across participant groups. Notably, the combination of VR and aromatherapy in elderly participants led to increased happiness, reduced perceived stress, improved sleep quality, positive meditation experiences, and enhanced life satisfaction. In patients with social anxiety disorder, VR therapy showed potential in reducing depression without significant changes in anxiety and stress. The studies utilized various assessment tools, including behavioral assessments such as the Stroop test, Go-No-Go task, and questionnaires like the General Health Questionnaire, GHQ, Depression Anxiety Stress Scales, DAS-21, and Positive Affect Negative Affect Scale, PANAS. Neurological assessments included electroencephalography, EEG, and functional near-infrared spectroscopy, FNIRS. The review highlights the potential of VR therapy as a novel approach for stress reduction, particularly when combined with other therapeutic modalities. However, it also underscores the need for further research to fully understand the efficacy and optimal parameters of VR therapy for stress management. This research investigation delves into the efficacy of virtual reality, VR, therapy in mitigating symptoms of stress, anxiety, and depression in individuals with mood disorders, specifically major depressive disorder, MDD, and bipolar disorder, BD. The study employs VR therapy sessions, comprising relaxing videos and soothing background music, and assesses symptoms using psychometric tests. The results indicate a significant reduction in symptoms across the board, with no adverse effects reported, thereby highlighting the potential of VR therapy as a valuable tool in mental health treatment. A comprehensive literature review is conducted to examine the existing body of research on VR applications in treating mental health disorders, particularly anxiety and stress. The review compiles studies investigating the effects of VR on anxiety disorders, including social anxiety disorder, obsessive-compulsive disorder, and post-traumatic stress disorder. The findings suggest that VR-BASED interventions, such as exposure therapy, cognitive behavioral therapy, and relaxation techniques, can effectively reduce anxiety symptoms, improve mood, and enhance cognitive functioning. The benefits of VR in terms of accessibility, cost-effectiveness, and patient engagement are also discussed. Furthermore, the importance of considering individual differences, such as personality traits and cognitive styles, when designing VR-BASED interventions is emphasized. The review also covers the use of VR in assessing anxiety symptoms, including the development of virtual reality-based questionnaires and rating scales. Studies investigating the neural correlates of anxiety and the effects of VR on brain activity are also examined, providing insights into the underlying mechanisms of anxiety and the potential of VR in modulating brain function. The review concludes by emphasizing the need for further research to fully understand the efficacy and limitations of VR-BASED interventions for anxiety disorders, and suggests that future studies should focus on developing more personalized and adaptive VR-BASED interventions that take into account individual differences and cognitive styles.